Good afternoon. My name is Chris Clark. I'm the Executive Director of Administration and Technology in the Cabinet for Health and Family Services. So what that means is I get to say grace over facilities, accounting, procurement, and information technology for the largest cabinet in state government. So if you're wondering what in the world is a facilities guy going to share with you today that relates to data and policy, I will bring you sort of that IT perspective, and I hope that's okay, wearing my CIO hat today. I want to tell you a story today, part of a story, and it's about the success of our Health Benefit Exchange Connect. And I get lots of opportunities nationally to tell this story, and I love telling this story. And I found myself on national panels often where being third on a panel, such as today, I'll have individuals get up before me saying, gosh, look at the federal government, they should never have done that, they can't do anything right. And panelists saying, in fact, that state governments are somewhat in the same situation. And we all know that these big, complex projects are prone to failure and they're high risk. So my best response to that is this slide, which wasn't always in my presentation, but it answers the question, why in the world did we want to build a state-based exchange? And the short answer is, as I believe you guys are extremely familiar, we're a very sick state. And so who knows better how to take care of the health needs of Kentuckians than Kentucky? Or who knows better how to take care of the health needs of Ohioans than Ohio? And who knows better how to take care of the health needs of our communities than our communities? And we truly believe that access to affordable quality health insurance is the key to unlock better health. Now, when we started building the exchange, we knew that we had a unique opportunity, and it was unique in the fact that government was going to be inserting itself in the process of obtaining health insurance between the individual and the private insurance companies. So certainly a unique opportunity. We knew, in fact, that this was something very important that we were doing, that we had the opportunity to change the health trajectory of Kentuckians, and that was always at the front of our minds. This was a very visible project. This is a project that I heard about every day on the way to work, on the way home from work, and even if you listen to Pandora in the shower like I do, yes, we had ads on Pandora. And so when we went live, this is what happened. There was a media sensation, and we absolutely weren't prepared for it, all positive, thank goodness, and Kentucky received quite a lot of positive press and attention because of our success, thank goodness. And I've often wondered if we had struggled or failed, as many others did, would we have received that level of attention? I don't think so. But we've certainly been all over the press. Beyond being visible, can we all agree this is a very polarizing conversation, very polarizing issue? It certainly was when we were building the exchange. It remains that today, I contend. And there are basically two opinions about the Affordable Care Act, two camps, those completely in favor and those completely opposed. There really was no one in the middle saying, I'm not sure, I'm going to see how this thing plays out and I'll let you know. And as we were building it, and I would submit even today, the information, the guidance on how to do this is still evolving. But that certainly was a challenge in the 1 year or less that we had to do this thing. And so that was our biggest constraint, in fact, time. Now, before we went live with Connect, the Health Benefit Exchange, this was the state of uninsured in our state. And the dark red represents, I don't know if you can see it, but more than 20% uninsured for a given county, the light red being 17 to 20%. And when you get to green and you get to blue, you're doing pretty good. After 6 months of enrollment on the exchange, this is what the map looks like. And so I'm not seeing any red. And I'm seeing a lot more green and blue. And in fact, in 6 months, we absolutely changed the trajectory, at least in terms of access, because we were over 20% uninsured across the state, and after 6 months, we cut that basically in half. And since that time, we've continued to make progress in this area. And so now, one of the articles, I think the last one that showed there, was the fact that Kentucky now leads the nation in dropping our uninsured rate to 8.5%. So it's something we're certainly very proud of. Expanded Medicaid is owed a lot of credit for that. If you look at the enrollment on the exchange, it's about 80-20, 80 being Medicaid, 20 being private insurance. And of course, with expanded Medicaid, we expanded coverage to adults at 138 of the federal poverty level, which is about $16,000 for an individual, or $33,000 for a family. Here's what the population now looks like under expanded Medicaid, with an enrollment of 1.2 million, which is about a quarter of our state now on Medicaid. What do you notice about this population? What's the majority category in this population by age? It's children. So, as we contemplate how we're going to go from access to outcomes, I submit that we have that opportunity with children to influence their behavior and to influence their outcomes. You may have seen this slide a million times. This is how sick we are as a state. We're a very sick state at 47th. Hopefully you, like me, are sick of seeing this slide. So we're sick and tired of being 47th. And as we celebrate this year the 50th anniversary of Medicaid, over that time period, we spent hundreds of billions of dollars and not moved the needle. We're still a very sick state. And the truth of the matter is, we didn't get sick overnight. So it stands to reason that we're not going to get well overnight either. Okay? But this is the go, getting from access to better outcomes. So how are we going to do that? You're probably very familiar with this definition of health being more than just the lack of disease. We've known this for a long time, haven't we? Isn't this the key? Not just treating sickness, but treating the whole person for all of the factors that influence their health. And so there's something called the triple aim that I'm sure you're familiar with, where we're looking to improve the care that we receive, improve the quality, measure outcomes, improve outcomes, and oh, by the way, we need to lower costs as well, don't we? The fact of the matter is, cost is unsustainable. There's too much variation in quality, and there's still a lack of coordinated care. So I want to talk to you very quickly about 3 initiatives underway at the state level that we think will take us further down the road from access to better outcomes. One is an initiative of the governor called Kentucky Health Now. It outlines 7 goals for where we want to be in 2019. The first go I would point out to you is reduce the rate of uninsured to less than 5%. Okay. We've made some good progress there. We've got a little more work to do. And then you can read through the goals. But there's definite focus there, I think, in the first 3 on smoking, obesity, and cancer. Okay. So these are good goals. And the key to understanding progress to these goals, no secret, is knowing where you are today, benchmarking, and then being able to measure that progress over time. Coincidentally, there'll be a new report released on November 10th, which will further measure our progress to these goals, so be watching for that. If we look at, looking at expansion, we've been observing for 2014 the access to services, and particularly the access to preventative care services. And the good news is we are seeing an increase. So those 7 goals of Kentucky Health Now, here are those measures in a chart. And you can see that we've made improvements in terms of access to services, preventative services, targeting these conditions. So it looks good on the surface. When you look at any of them individually, 169% increase in access to preventative services or counseling for tobacco cessation. That sounds great until you see, well, gosh, on a population of 1.2, that's only 688 more of those events. And we could keep going here. Here's diabetes, 55% increase, 430. Diabetes again, gestational, same story, 13% increase. When we get to the cancers, there's a more significant increase, so this is encouraging. 110 increase, so 26,000, 27,000 more services provided there. Colorectal cancer, 108%, 18,000. cervical cancer, 88%. So you can see the statistics here. But the long and short of it is, while we're making strides and people are accessing preventative services and we're seeing improvement, it's not good enough. It's not going to get us there. So, let me get through these. I'll be leaving you, by the way, with a lot of slides that you can tell I'm challenged to get through here so we can leave time for questions, but you'll have lots of good information, hopefully. Yeah, it's not good enough. And the fact of the matter is, this new population, they haven't had health insurance for a very long time, possibly even at all. They don't even know how to use health insurance. So outreach, engagement, education, absolutely critical. So there's a statewide initiative underway. It's called State Innovation Model, or SIM for short. We've been meeting with hundreds of stakeholders monthly since March in a large group, and then we have 5 work groups that meet also monthly. And it's aimed, if you'll allow me to say that, at the triple aim. So it's, looking at reforming the way that we deliver health care in the state, backing that up with payment reforms that reward outcomes as opposed to activities, and then looking at the health information technology component that needs to support those initiatives. We're one of about 32 states today that are pursuing a SIM initiative, and they're either in design, such as the Kentucky, or they're actually already testing some programs. We see ourselves we hold many roles. Perhaps the key role in this initiative is that of the convener, and so that's what we think we bring to the table, as well as being a provider, a payer, and various other roles. Lots of tools in the toolbox. Some that will be focused on include different delivery models, including accountable care organizations, which there's already, activity underway in the state, which is great. We want to create an environment that fosters even more of that activity. Bundle payments, episodes of care, patient-centered medical homes. We have a lot of great tools already in existence in the Commonwealth, including a great state-based health information exchange, so that we can actually exchange information provider to provider. And then we're involved in an initiative with our public health departments that I'm really excited about to implement electronic health records at each of our public health departments across the state. And public health plays a very critical role. They're an important piece of the puzzle when it comes to public health. And I've gotten the 1 minute to go signal. Okay, so let me get through these. There's a lot of overlap between SIM and Kentucky Health Now. That's a very good thing. So one thing we all need, I believe, is data to measure, benchmark these programs where we are today and where we want to go. So the third initiative is something we're calling the Health Data Trust. You may also know it as an all payers claims database. How the Health Data Trust is different is, in addition to claims information, we do plan and hope to bring clinical information into that capability as well. We're very aligned with the Foundation for Healthy Kentucky, who convened a group in October 2014 and gave us some recommendations to think about in terms of how this thing should be built and supported. I think we know what APCDs are. States are pursuing these across the nation, and so you have a slide that points that out. Part of the key to success, I think, is focusing on the consumer. There's so much information out there. How do you bring it all together? And I think you do that by focusing on the consumer. We partnered with the University of Kentucky in this endeavor, and the way that this is going to unfold is it positions, so we've engaged stakeholders, as you can imagine, internal and external stakeholders, including providers, payers, et cetera, et cetera. And so we've gotten stakeholder feedback about the benefits that they see in doing a health data trust, some recommendations on how we need to protect the information, and then the approach, starting small and phasing in. The way we'll unfold the Health Data Trust is position the Commonwealth as the honest broker. Because you have to get the data in, and you have to link it together, and then you have to de-identify it and assign a different unique identifier and lock away the keys and all that good stuff. We think the Commonwealth is best positioned to do that. That's the way the model is being defined, so that when we de-identify data, UK would take over at that point Data is de-identified and available for use. It would unfold in 4 phases. We're going to start small, including the data that we have. We're going to save the easy part for last, which is getting the private payer information. I was hoping you'd pick up on that. And finally, I think I just want to stress how important this health data trust is to underpinning things like Kentucky Health Now, as well as our SIM initiative. And, we have reports out there now that you can access on the website, and they're just that, they're reports, but they're not interactive, they're not visual, and that's where we really need to get to, which is what the Health Data Trust will accomplish. I've left you hopefully some good resources so that you can play with some of the statistics that were in these slides. And the final thought that I'll leave you with is, now I am keenly aware that there's a minor election next week. So these are noble initiatives. These are initiatives that have a lot of value. So it's incumbent upon you guys and myself, all of us, to continue to support these efforts as stakeholders, to push Kentucky Health Now forward, to push SIM forward, and to help push the Health Data Trust forward as well. Thank you very much.